Hey, what's up everybody? Dr. Ryan Weaver here again with today's spinal workshop topic. Probably one of my favorites, something I had a lot of passion in and still do, especially coming through my school career. And we're going to be talking about extremity injuries that we see. The 7 major extremities of our human body: our ankles, our knees, our hips, our shoulders, our elbows, our wrists, and one that gets kind of thrown out there to the side that we don't think about a lot is also our jaw, our TMJ joint. So we're going to run through this spinal workshop talking about a few of the most common injuries that we see and we can help heal and treat in our office. And a lot of people don't necessarily know who's the right person to go to, but we're going to give you kind of our point of view on some of these injuries. And the injuries that we are going to talk about are basically a fauche injury, which is a fall on the outstretched hand, or basically just a shoulder in general, shoulder injury in general. Then we'll also talk about ankle sprains, inversion sprains, which is the most common. But we're going to talk a lot about that. This can happen to really anybody though. And more importantly, or more specifically, we see this a lot with high school athletes, college athletes, athletes of any type, even our weekend warriors. So with these, we're going to talk about some of the symptoms that you may see, also how we can help treat those, and some other interventions that you may have heard of that we can also do in our office. So before we get into this, again, we do these spinal workshops to always continue to bring you up-to-date information for certain injuries, certain diagnoses, things that we treat in our office, but also to give you hope that there are other things besides surgical intervention and drugs and surgeries, of course. So do us a favor on YouTube, if you're watching it there, on Facebook. If you see something on here you like, comment, like us on Facebook, follow us or subscribe to us on YouTube so that you get all these up-to-date information and educational courses that we put out called our spinal workshops. We're going to be doing a lot more of these this year, and we hope to be doing some different kind of videos where you're going to see a lot more kind of like some PowerPoints and things in the background as well. So let's get started. The first that I'm going to talk about is a shoulder injury that we most commonly see. You heard me reference it earlier, a fauche, fall on the outstretched hand and arm. Really what happens there typically is your pec can help when you fall and you strain the pec muscle, it may round your shoulder forward. You've also heard us talk about this a lot with posture nowadays, how we end up having those hunched shoulders. Now, this is the actually injury that can cause the same thing. So sprains, strains, other big ones that you hear, tendinitises, again, inflammation of the tendon, bursitis, inflammation of the bursa, shoulder impingements, another one that we see a lot of. And some of the most common treatments are actually where they cut and shave some of the bone off to open up the impinged area. So we're going to talk a little bit about that. But most commonly, especially in our office, what we look at is the alignment of our shoulder blade and how that articulates back and forth, meaning how does it move from a biomechanical sense. So again, from a side view, if this is rounded forward and down, that's going to really kind of fail one of the most common orthopedic tests that we do in our office called a Mazion's test, where we have the patient basically lift their shoulder up or their elbow up over head. And a lot of patients you see, if they've had some shoulder injuries in the past or even a recent one, is where they can only go so far halfway. So the byproduct of that misaligned shoulder blade, humerus, clavicle, those are the three bones that make up the shoulder joint itself. What you see are sprains, strains, tendinitis, bursitis, and impingements. So just treating the sprain, we want to look at the whole picture. Some of the common things you can see here: injections, painkillers, some muscle relaxers, even some steroids. But when we look at the stability and strength, again, we also want to keep that aligned properly, but in a strong position. So some of the things that we need to look out for, if that's never been addressed, and you heard me mention earlier, is this a recent injury or a long time ago or a chronic issue? If the bones of our shoulder girdle, again, shoulder, blade, clavicle, in your humerus, if those aren't in the proper positions, then the tissues will basically heal incorrectly. Some of those examples, the ligaments of those areas will be sprained and be stretched, and they'll heal and develop long-term instability of the shoulder joint. So, bringing this full circle, another thing that we can do in terms of treatment, we're going to talk about a cold laser here in a little bit, because you can also use this on your ankle, which is what we're going to transition to now. Common injuries of the foot and ankle, of course, you can fracture those. Ankle sprains, plantar fasciitis, Achilles injuries. We've seen that a lot recently, especially in professional athletes, a ton of Achilles injuries. The mechanism that you usually see with a ankle sprain is an inversion or a eversion sprain. More commonly inversion, okay, so typically when you think of rolling your ankle, that's what that is. The second is what we call an eversion ankle sprain. Typically, if this has happened, you usually end up with some fracture somewhere, because again, it is the more uncommon, and there's a lot of torque that gets placed on the eversion sprain. But breaking down our injury, when we sprain, and when I reference this right now, I'm referring to an inversion sprain. This may cause a high ankle sprain, where the ligaments of the tibia and fibula are overstretched above the talus bone, but a low ankle sprain is the opposite, just below the talus bone there. Again, with the eversion sprain, you're typically going to see a fracture with the fibula, but anyway, back to that alignment. Stretching the ligament, meaning by default bones shifted in one way, shape, or form. So we want to make sure those are aligned. Again, we call that a subluxation. Another common one, I did mention this earlier here, is plantar fasciitis. We see this a lot in our office. We've had a lot of good improvements with this. But the inflammation of the plantar fascia, which can be most commonly caused by these few things. We hear the shoes, we hear overuse, we hear the walking surfaces that we're on, and also the foot structure. Again, to us, the foot structure being misaligned is one of those subluxations. But again, these all play off of one another. People who have an inversion sprain, they could end up with plantar fasciitis. People who have an inversion sprain could end up with Achilles tendonitis, ruptures, or tears. Because if that foot is not flowing and moving like it should, all 26 bones of the foot, then we can have a lot of issues, even up to our knee and our hip. We can correlate those all together. So same as I mentioned with our shoulder, we want to make sure the hip alignment, the shoulder alignment and our ankle alignment is properly in the right position, so that it yields the best healing from nerve flow to blood flow. Lastly, the cold laser you've heard me referencing. The cold laser, it's not actually cold to the touch. It's considered cold because it doesn't emit heat. What that basically does from a cellular level is speeds up the healing process, which allows the metabolic process to basically amplify and speed up faster. This is a very common thing that we use in our office, especially with athletes, between shoulders, elbows, and wrist. I used it a lot in college with knee issues, but again, it's a non-invasive procedure. There's no pain from it. Typically, you don't even realize that anything from the patient standpoint is really happening. So if all those things help us heal and help us heal faster, depending on the issue, with ankle sprains, if you're an athlete, one of the common questions I get from coaches is, how fast can we get the athlete back safely into competition? And a lot of coaches ask that question, a lot of parents ask that question. Of course, from the athlete point of view, you never want to miss practice, you never want to miss games, especially. So how can we get you back on the field and ready as fast as you can? But also, if you're a weekend warrior, you want to get back and live in your life and not be laid up or have to, basically alter your life because maybe you have an ankle sprain and maybe you will be in a boot. So a lot more that we can share specifically on the ankle and the shoulder, but really even getting into the wrist and elbows, the jaw, these are a lot of extremities that a lot of patients don't necessarily know that there are other options, especially in chiropractic care, how that can be helped and improved. So I hope you found a few of these things on here interesting. We'll look forward to doing more extremity talks throughout the year. Again, if you're a coach or an athlete or a parent and you have any questions, definitely feel free to reach out to us. So we'll look forward to seeing you in our next Spinal Workshop. Have a great day, guys. A blessed day, and we'll see you soon.